Go ahead, Chair Hill.
Hi, everybody. I'm not going to waste a whole lot of time on my welcome other than to say I think hope is on the horizon. Things are looking good. We have a huge agenda to get to, so I'm just going to hand it over to the Chancellor for his updates.
Great. Well, thanks, Shana, and I would agree. Hope is on the horizon, and as I've either been describing it that way, or that sunshine is on the horizon, even though it's kind of a cloudy day here in Chapel Hill. But it is great to be back with you in the new year, and I hope that your semester has started well, despite the fact that some would argue it still feels like we're in 2020. But I do think we're seeing some progress and some hope. I want to get your ideas today and input on two issues. But then we can open it up to whatever's on your mind. I can't thank you enough again for agreeing to serve on our new staff advisory committee to the Chancellor. But I'm going to talk a little bit here about sort of COVID related updates, and then a bit on the budget, and would love to hear your feedback on that. But again, as I said, we can open up to whatever's on your mind before we get to Becky. We know that there's no one solution to try to prevent the virus from spreading. So we're really continuing to use what I would describe as a layered approach to manage it from every way possible. And I think you're well aware of our asymptomatic testing program that's continued. I just got an update earlier this morning that we've now, as of yesterday, we're well over 21,000 tests that have been conducted on our campus. We're averaging about a 24 to 36 hour turnaround time. And we have about right now a 0.51% positivity rate, which is certainly better than what we saw last semester. And I think it just speaks to having these additional measures in place to try to help keep the campus community safe. Another important number is that we identified 161 positive cases in what we're calling our prior to arrival testing, meaning that as students were required to produce a negative test before they could arrive back to campus a few weeks ago. And some are sort of staging their return, more of a delayed return. But we've identified 161 individuals who didn't come to campus because they tested positive before they came, and so they remained home in their community until they met the required isolation quarantine period. And so we're now able to catch those clusters more easily, prevent the clusters from occurring, even though we've said early on that we will have positive cases on our campus. I mean, it's just a known fact based on the data. But I think we're prepared to handle them, and we're tracking those cases. And we believe our status on campus is stable right now. And we have addressed concerns such as some of the wait times that we saw the first few days of testing at the 3 centers. I've had a chance to visit them myself, and they seem to be running smoothly. I've been out to a few of the testing sites twice, and at least all of them at least once. I've been over to the testing laboratory over at the Genome Sciences building, and I just can't thank those who have helped us to stand up this operation in relatively short order, and for the many volunteers, faculty, staff, and students who are really making this possible. I think we want to just continue to hear feedback, though. I've heard some of the concerns from staff around the earlier openings for third shift workers, and we're making that happen over the next week. I just got an update on that this morning, and so we will accommodate those on third shift to be sure that they have the ability to be tested when it's most convenient for them. And so again, just a lot of work, and we're just grateful to everybody's help on this. During the week of move-in, the COVID-19 Student Services Corps served a total of over 1,500 hours alone, and it's just incredible. And I think with the vaccine now, there is light at the end of the tunnel, but we still have a long ways to go. I want to state what I said at the joint meeting of Employee Forum and Faculty Council about probably 10 days ago or so, that we're working really hard to advocate for our staff and faculty who are frontline workers on campus to receive the vaccine as soon as possible, not to jump line, but to be sure that they are um, able to be vaccinated as soon as there's available vaccine. And this is good news that they'll be included in that next wave. There are 5 or 6 different groups that we've talked about. These are our housekeepers, our food service workers, our police officers, our maintenance staff, our transit workers, and then our in-person faculty who are either teaching in person or working in their research labs. And right now, it appears that we are just right at the end of, we have accomplished the vaccinations and have made that possible for all of our healthcare workers. And so now we're hoping that the vaccine that is available can be pushed out to these frontline workers as soon as possible. So I guess I'm going to stop there, see what you are hearing, what you think we can do better. Also, how can we communicate more effectively around all of these issues? I know there's been some frustration just around the information around the vaccine distribution, but it has been changing every week, as you know, and so we're trying to stay up to date on that and to provide as much information as possible. But why don't we stop there? I'll see what your thoughts are, questions you might have, and then I'll say a little bit about the budget.
So Chancellor, I had a couple of folks ask about including student services folks in the wave of frontline employees. Can you talk a little bit about people who are showing up in person, not just to teach, but also to accomplish their duties? Are they going to be included in that wave?
Yeah, the definition right now, as Department of Health and Human Services has defined it, is that these are employees who are essential. That their job has to be carried out in person, and that they are front facing, so they are interacting with others on campus. And so yes, they would fall into that category. I kind of bucketed them, but anybody who is in person and interacting regularly with people, and especially they still talk about the 6-foot distance. If there are interactions with multiple people within relatively shorter spaces, smaller spaces, that even that really is part of the qualification. But I think we've been able to provide lists of these employees. Kathy Brennan's done an incredible job, Environmental Health and Safety Director, of uploading all those employees into the system who we believe meet the criteria. And additionally, we're producing lists of those individuals with cell phone numbers, so that even if at the end of the day there's available vaccine, that they can reach out and contact these individuals so that they might quickly be able to get over to a site to be tested and to be vaccinated. And so we're working hard for all of those individuals to be eligible. Phil.
Yeah, I had a question. An employee forwarded me an email. There was a forward from a listserv. There was a forward from a listserv about a volunteer opportunity within the UNC Health community vaccine clinics. Apparently, this is something that the School of Medicine is coordinating. This is not a gotcha thing. It's just something I found this morning and I had questions about. Apparently, for UNC employees and UNC students on UNC payroll, there's the opportunity, as far as this email suggests, to volunteer with one of the community health clinics and in exchange receive your vaccination. So I'm concerned in 2 ways. One of which is that this is information that got to me from a forward to a forward, and everyone I've asked so far this morning has no idea that this was an opportunity. So from a communication standpoint, I kind of wonder, what do we do with this? Secondly, it seems as though the folks who would, and to tie back to something that I think Jennifer mentioned first and Maria tapped into, and James Holman in the last meeting, around how we might get information like this to folks who are not reading the emails that come out or need some alternative ways of finding out about this particular opportunity, or the ability to use COVID-19 community service leave to take that time off to go and be vaccinated if they were going to volunteer. I'm wondering, like, how do we actually get that out to folks whose communities might have been disproportionately impacted by this, who are not in one of the priority groups? I have two questions, I guess, and if this is an email that you haven't seen, I'm happy to share. I can share my screen.
I have not seen it. I'm not sure, Becky, if you have seen it, but we certainly, if you want to forward it along, if Becky doesn't already have it, and we can look into it and see how we might be able to communicate this out to the employees.
Okay.
I had heard that there were, so what I do know is that there had been people asking, given how slow the vaccination process was going, whether there was need at UNC Healthcare or elsewhere for volunteers, and if so, could we be helpful? I did see that there was a message that went to the dean saying we're standing something up, but I do not know of anything that, and UNC Healthcare has been pretty clear in saying nobody's jumping the line. So I don't know of anything that allows you to volunteer and jump the line for being a volunteer. That seems to be new information. And the message that went out went to the deans yesterday, just saying we're standing it up. So I think this is still we're trying to figure out how to utilize volunteers in a process that is still somewhat limited by when and how we receive vaccine, because it appears that there is a pretty good structure to deliver the vaccine. The challenge becomes when the UNC Health is receiving the vaccine and then being able to accurately and effectively deploy it. So it may be that what you have is the same thing, and maybe that it's something different. But if you want to forward it, we can certainly try to get to the bottom of it. But I don't think this is a case of there is something fully stood up that we can actively deploy to employees. To your second question about how are we getting to communities that are underrepresented or trying to target specific areas, I admit to not knowing as much about that, but Christy Page talked to a group of us the other day, and they do have a associate dean for health disparities working with a larger group. They are connecting we just had somebody, a pastor in Durham, say, I want to know how I can be visible in getting my vaccine so my community knows that I'm doing this. And so there is a committee working on outreach. It appears to be largely driven by healthcare with some liaison thus far with Gillings, but I don't know how broad they've extended. I know there's a bunch of people involved. I just don't know how far that's communicated onto campus yet.
Okay, that's fine. I'll forward you the text. The
Perfect.
earliest email in that thread, like the farthest back it goes, is Sunday, January 24th.
Okay.
That'd be great, Phil. And then we can get with Becky and Shana to think about how we best get that message
Absolutely.
out to the
Yeah,
masses.
I'll just jump in to say that I also received that message. I copy and pasted it into the team, and it's basically saying we need volunteers, and if you volunteer, you can get the vaccine.
Okay.
I'm aware of at least one person as of last week who had gotten the vaccine for volunteering out at the Friday Center.
Okay.
And I don't mean to
There you
question,
go.
and I don't mean to question the motives of the folks who are there, but like I am concerned that there are equity issues that are introduced with this sort of signing up to volunteer in order to get this to get the vaccine, and I don't know that they haven't been considered, but I don't know that they've not been considered in setting this up. So just more information would be helpful. Thank you.
I can speak to some of the school medicine issues. Dr. Tommy Kuntz, we have a bi-weekly meeting to talk about the needs of the vaccination center, and they need a lot of volunteers. And so I can put you in touch. I can send to Shana the information that you can contact the people and sign up for volunteering for that. And that was because they needed so many people. That was one of the incentives to get people to come there, was that you can get vaccinated to be a part of that team.
Got it.
That didn't go out to everyone, is what I think.
No, it was generally within the school of medicine, within the health system per se, the outpatient care center. They solicited volunteers from all the clinical areas, and then I guess they want to expand it because they have more need than they have people.
And some of these positions were like for runners, wayfinders, greeters,
Exactly.
registrants, front desk, so like non-clinical.
Correct.
Non-clinical. One of the points, Kevin, that you made that I had a lot of questions about was how are they determining who are the frontline essential people on campus? And so I think someone earlier brought up student services, which there are parts of student services that have to be done in person, and we have mitigated that, like I-9s, for example, or visa paperwork that has to be signed in person. And we have mitigated that to some extent while we've been remote. The State Department has delayed some of those page 2s from having to be turned in and things like that. But as a department that processes these a lot, and with the business center as well, I'm just trying to figure out, and especially with student services, there is that face-to-face kind of contact that has to happen on some things. And so I'm just trying to determine who's determining what is frontline, what is essential, and how is it getting to the people who are determining who needs those vaccines. Because if the students are coming back on February 8th, to some extent, the State Department may determine that we have to do these things in person now. And so I'm just trying to figure out the logistics on that.
Yeah, Jennifer, thank you. And I'm taking notes here, and we're gonna see which category those student services, front-facing essential workers, which category they fall into. But clearly, I agree. I mean, even are those working in the libraries? I know that they are included in this. Those working in student rec centers and other units that are affiliated through student affairs. So we will be sure that that's properly defined and that we can get them into the on those lists.
So I think and Kevin, you can correct me because you've been in a little bit more recent meetings than I have, but I just want to clarify something. The university is not making the determinations about who gets the vaccine when. That is the responsibility of the North Carolina Department of Health and Human Services. To Kevin's credit, in a huge way, we have founded a really excellent relationship with them. And together with the system office, we have been advocating for the definition of educator under the category 3 to be as broad as possible, to his point, to include student services folks and librarians. And it originally said educator. And we're really trying to advocate for that to be anybody who has face-to-face contact with students 6 feet or under. But they are defining that for us to some extent, in that we are saying these are all the people we want. But if ultimately we make all of these proposals and they cut some off, that's not because we don't care about all of you. It's that we're trying to be as inclusive as possible to get as many people vaccinated as quickly as possible. But ultimately, the decision rests with the North Carolina Department of Health and Human Services. And I believe that's still accurate, Kevin. If I don't want to misstate, because you had a more recent meeting than I did, but a couple of days ago, that's where we were.
Yes, that's correct, Becky. And thanks for making that clarification. We have every other Friday, we have a meeting. There have been a few university leaders invited to meet with DHHS, their leadership around vaccine distribution. And Norma Houston from the system office has been very effective in those meetings about advocating for the system, broadly speaking, about making certain that our university employees who are essential workers in person are part of that, to Becky's point. And so, and then the additional step that we've taken here at UNC is to be sure that these distribution sites have quick, easy access to these lists of individuals who might be able to get there quickly in the event that it's 4 o'clock on a Wednesday and there's the people that didn't show up for their vaccinations, and that they can quickly call these individuals because they've made it clear they don't want to waste vaccine. And so, we're working hard to do everything to get these individuals in line. Brian.
Hi, Kevin. On the theme of communication, I was curious what interpreting services we have available for staff at the testing and vaccination sites, particularly for folks where English is not their first language and may be somewhat overwhelmed by the healthcare environment they face when they walk into a testing or vaccination site.
Brian, I missed the first part of your question. Did you say, if you could just repeat the question?
Sure. I was curious what interpreting services we had available for staff at the testing and vaccination sites.
Yeah, I know that this did come up in a meeting the end of last week. And so Chris McClure and Amir Barzan and others that have helped to stand up these sites. They're working on that to be sure that everybody's comfortable when they come in there. We recognize that we do have individuals that need, to be able to, they need an interpreter. They need to be able to understand exactly what the instructions are. I don't have the specifics on what's being done about that, but Becky, I don't know if you were in on that meeting.
Well, I was not.
Okay, I'll double check on that, Brian.
Okay, thank you.
Other questions?
Chancellor, this is James Holman.
Yeah, hi, James.
Hi. I've got a question. A lot of the staff are asking me, is this mandatory for all staff that work on campus to be tested?
It is not mandatory. We are strongly encouraging our staff to be tested at least once a week, and it is mandatory for students living in the residence halls to be tested twice a week, and for students who are enrolled but living off campus in the surrounding area to be tested at least once a week. And we're strongly encouraging our staff to be tested.
Okay, thank you.
Okay, if moving along then, if there are no other questions on this, I may just jump up to just say a little bit about the budget. As you know, we've sent some correspondences out regarding this, but it's been nearly a decade since we've had a balanced budget here at Carolina. And we've been working with leaders across campus over the past 10 or 11 months to try to solve this problem. We've had public conversations about the budget challenges beginning in March, and I'm proud of the work that we've done to be as transparent as possible. We have a responsibility to update those who are most affected, potentially most affected by the decisions, and to give them a sense of what the challenges are and what we're doing to fix it. We are now on the next phase of this process. The campus message that was sent out on January 15th summarized what was put in a memo on January 13th to deans and unit leaders. And let me just say that those individuals who received that correspondence on the 13th of January had been part of several other meetings that had taken place over the past 2 or 3 months leading up to this, where we could finally articulate the sort of what the plan was. And we also talked in there about the challenges related to COVID-19 and some of the COVID-related impacts to the budget. We talked about the structural deficit that's been growing over the past several years, and we also know that we have deferred maintenance issues that we're trying to address. Unfortunately, these budget reductions that we're working on now to balance the budget will not address deferred maintenance, but we're working really hard to try to find a way to have resources to take care of some of the deferred maintenance here over the next few years. I'm meeting regularly with Nate Knuffman, the interim vice chancellor for finance and operations, 2 or 3 times a week. His team has now met as of yesterday with about half of the 32 units on campus since that budget directive was issued on January 13th. And I really believe we're making progress based on the feedback I'm getting from Nate. But again, I think these are critical steps that we're taking so that we can really prepare our campus for a sound financial future. And I've also, talked about the importance of not only getting to a balanced state, but where we may, in a year and a half, 2 years from now, have a reinvestment fund available that we can begin to work toward funding some of the initiatives in our strategic plan, which is what any great public university should have as a way to reinvest and to really support these initiatives that are moving forward and that will move the university forward. I know Becky's going to talk about one of those in our strategic plan here in a few minutes around career development. But I think just to restate what has already been said in these memos is that we've directed our schools and units university-wide to reduce personnel funds by 1.5% and operating funds by 7.5% for fiscal year 21 and 22. And I will tell you that a lot of planning went into this, looking at different options for how we could balance the budget and how long of a period we should work to try to accomplish that goal. But this is, it's going to be important for the future of the university. I know that some individuals are asking why we're trying to do this now in the midst of a pandemic. But I would just argue that we don't know what the future holds, and we have to ensure the financial stability with this uncertainty that exists. And this is really the most responsible course of action that we could take. And so it will allow us to eliminate that $100 million structural deficit in central funds by the end of fiscal year 21-22. And then, on the personnel side, I want to just, we're going to clarify which positions are moving forward. Becky and Link Butler and I are part of a meeting every week where we do look at requests that are coming through for personnel actions. And I really want to credit all of the units on campus, because I think we've been really fiscally responsible and over the past several months since the pandemic started to try to still move the university forward, make sure that our essential personnel are supported and that they're in the roles that are allowed to move their units forward, helping to move their units forward. But we've held back on many vacant positions so that we can get to a better place and identify what really is needed. The schools and unit leaders are determining the positions that are essential to the institution. So these aren't top-down decisions, but we're working closely with them to try to identify which positions are might be able to be collapsed, where essential job functions where we might become more efficient. And I just want to credit Becky and Link Butler and their team for all the work that they're doing to try to support this effort. It's not going to be easy, but I do feel confident that we're going to get through this together. And so I'm happy to open up the floor to hear your thoughts. I also want to look at the clock here and be sure that we have time for the other items on the agenda, but I'll stop there and take any questions, hear your ideas, and then we're going to turn to Becky to talk about Carolina Next and the career development initiative that she's been helping to lead. Any questions, thoughts? Jennifer?
My only thought, in looking at some of the budget cuts that are looming in the College of Arts and Sciences, some of the budget cuts I feel that could have maybe required more thought, like the VTA hiring program. I saw the article this morning that we're pausing that, or that we've gotten rid of that program for now, or paused it, so that we can assess the financial ramifications. And I do understand that we cannot continue on without a balanced budget, and that we need to figure out ways to do that. But to me, in this climate, with this racial awakening that's happened this summer and the things that are going on campus, pausing the only program that sometimes allows us to hire people that are of minority persuasion into our university seems a thing we just don't want to do right now. I worked in romance studies when we hired our first Black professor ever in 100 and something years. And I can tell you that means something to people. And the fact that we're not being allowed to hire in that way seems to be something that I feel like we should address, and not just because of what happened this summer and what is continuing to happen in this country, but because if we're really committed to diversity, we should make that our priority, regardless of budget and other things that are going on. And I see a similar pattern happening sometimes with the staff positions too. But this time I'm actually advocating it for the faculty positions, because I see what happens when we have a diverse department and when we don't. And so I just wanted to put that out there. It's just something to talk about as we continue on in this group.
Thanks, Jennifer. And I have not seen the article that you're referring to yet today, but I've had conversations with Bob Lewin and Ron Strauss over the past few weeks, because I think there's some communication, misunderstanding around that VITA program. We do remain committed to it. I don't believe that it has been suspended. And so I need to follow up on this and look at this article. We remain committed to bringing the very best faculty to Carolina, to retaining the very best faculty, and to be sure that we have a diverse faculty that can best meet the needs of our students to deliver our curriculum. And so we are very committed to everything you just described. And so I'll have to go and take a closer look at the article. Other thoughts, questions? Phil?
I hope this is just a quick question, but we've been talking some in our unit around the things that we've been approved, the financial tools that we have in our toolbox that we have been approved to do versus things that still might be pending. So early retirement and the ability to furlough and use other tools, I think were things that were still outstanding the last time we spoke. I just wonder if there was an update on what the university is approved to do versus what we might be waiting for in terms of those financial tools.
Sure. Becky, I'm going to turn to Becky because she's
Yeah.
on this daily, I think, and we
Sure.
have a lot of conversations around this, and we're trying to, prepare departments and arm them with the right toolbox. So Becky, any updates on that?
Sure. So representatives from the HR office are meeting with the individual units together with our finance colleagues as we're having these unit meetings and talking through this. We're also working on a document that outlines what the tools are. Admittedly, they're not as many as we might like. We are really encouraging people to look first and foremost at vacant positions and eliminating vacant positions, which will not have an impact on anybody who's currently employed. And then we are talking about the potential for an early retirement program. But as I've mentioned before, that is on the systems legislative priority list. They've been in Raleigh talking about it, but we're waiting on the General Assembly to convene later this month, early next month, and hopefully we'd be able to move that forward. And then the other tools have a lot to do with reductions in FTE, reductions in base pay, RIFs, that sort of thing. We certainly want to try to help units avoid more drastic personnel measures where they can by dealing with the things that have less direct impact on people currently employed first. And that's part of the reason we're spending time talking with them. Furloughs provide a temporary base adjustment or a temporary relief, but they do not provide the recurring budget dollars that this effort is going toward. So a furlough would not be a solution that we would put in place. Of course, you also, as you sort of point out, we don't have full authority to do a furlough right now. So we couldn't put that in place across the board if we wanted to. But even if we did, that would provide temporary dollars, one-time dollars, but it would not provide the recurring dollars that we're looking to meet in this budget request. So I don't expect we'll see furloughs on the table.
Brian.
Hey, Kevin. In terms of the budget, I was curious. I'm assuming as part of the planning that led to the identification of the deficit, that the leadership team was able to positively identify practices that may have led to that deficit. And if so, was it identified in a way that will allow the leadership team to be able to hopefully avoid similar practices in the future? Or is it the sort of thing that wasn't controllable at the time? And so really future planning won't prevent it necessarily either?
Yeah, it's a great question. I mean, in all honesty, I mean, we didn't have a budget model up until probably about this time last year. And I have to credit our finance and operations team with really doing a lot of work over about 18 months leading up to about this time last year. And then a lot of work that's happened since then to be able to create dashboards that the central finance team could actually see what is out there in all the units, providing better resources and tools for the individual finance leads in those units to begin to look at the different accounts and where there were commitments made. To your point, for many years there were commitments made out of the center to help support faculty hires and startup packages and retentions and some funding, one-time funding that went to new buildings and new programs, new departments. Also some kind of unfunded mandates for salary increases for faculty and staff on two different occasions that helped contribute to this. So there were a number of factors that we've identified that helped to contribute to this shortfall, this $100 million deficit. And so, yes, we have the measures in place now. We're also changing the F&A distribution model, which is going to help many units have more control over their indirect dollars that come off of research grants. They will have to support more of those sort of initiatives that were otherwise being funded out of the center, out of the provost office, such as startups and retentions, but they'll have more control over it. So I think we're going to be in a much better place because of all this.
Thank you.
Maria.
Hi, I just want to go back to what Jennifer said before, just to support it in the sense that, I don't know, I've been thinking about how budget is basically a statement of an organization's values. And, you know, every unit is best positioned to determine what are the right cuts to make. But sometimes I worry that like the easiest cuts to make may not always be the right cuts to make. And so I'm just wondering, like, is there a mechanism by which we're looking across all the units at the budget cuts to think about that, right? Like to just think about that balance between what needs to be done, and if that really is true to the values, as for example, as they're represented in the strategic plan, or the values that we have made commitments to.
Sure. No, thanks, Maria. You know, in those memos that went out, and I did list in that campus message on the 15th of January, the 8 sort of guiding principles that we're asking units to sort of help guide their decision making as they think about cuts. We are asking them to take a deep dive and to look at where their programs and initiatives align with Carolina Next's strategic plan, and if there's a malalignment or programs that are underperforming, under-enrolled, or just simply not aligned with their unit's own strategic plan or with Carolina Next, then these are opportunities. This is a time when you might want to look at consolidating or eliminating these to help get to the target number that we have directed to broadly speaking to the units. So while central finance is working closely with the units, those units do have the autonomy to decide where those cuts are made. Even the vacant positions that, as I mentioned earlier, that we look at weekly, where requests are coming through, we don't want to assume that just because we've held off on filling a position over the past 9 months in the middle of the pandemic, that's one that a unit could just eliminate permanently. They may say, no, that's really a position that's essential to our unit. We need to get it filled here in the next 6 to 8 months, but we're going to instead of that, we're going to suggest eliminating a different position and really turning that back to them. Becky, I don't know if you'd add anything to that.
Yeah, I would just chime in and say that in the conversations we're having, we're reminding units that what they present in response to Kevin's message is a proposal. And while those we want the units to have autonomy and agency in determining what's best for their unit, because obviously the college knows what's best for the college. We also are going to look at all of those proposals will be submitted, and Kevin and his team will get a chance to look at all of them. And if we say, oh goodness, we're cutting these 3 things that are actually really important, we're going to have a discussion about that and decide whether we're going to do that. As we think about personnel related matters, we're going to work with our colleagues in the EOC office, because we need to make sure that any adjustments we make to the personnel and staffing we have at the university, that we're doing so in a non-discriminatory fashion. We've also been clear with units, we cannot have any cuts that we make, either to programs or to personnel, fall on the backs of any one employee type. So I think there have been discussions. How those play themselves out in the activity of looking at budgets that are already tight. People have been managing tight budgets for a long time, as we've seen different sources of funding change over time. Sometimes you're right. It looks like, oh, that's the easiest thing, but is it always the most strategic? These decisions are hard. And I do think people are trying to make a good faith effort, but it will take all of us to come together and say, collectively, is this the way we want to do these cuts? And it's going to be an iterative process. And hopefully we'll get an answer that however hard it is, it's the best one we can make at this time.
And I think if I could just add, thanks, Becky, to Jennifer and Maria's points, that the DE&I is listed in those guiding principles as something we're asking for every unit to be cognizant of that this is important to us as a university. So we were very deliberate in putting that in there in those guiding principles. And so, and just trust that Bob and I are committed to seeing these VITA hires that are currently underway through. I know that, again, I need to go back and look at this article, but until we work through the process over these next several weeks, perhaps they're not taking any additional ones till we get to a good place. But I know that we're committed to seeing those through that have been committed to.
Thank you.
Thank you.
So I just want to make us all aware of the time, because I know Becky has a presentation and then we have goal setting at the end. So if there's no reason not to, can we move on to Becky's presentation? And then if we have to do the goal setting, we can do it via the team site. But I do want to give folks a chance to ask the questions that are on their mind.
Sounds great, Shane. I think we pivot to over to Becky.
All right, let me see if I can, let's see, advance, multiple participants. I'm having some trouble with the, there we go. Let's see if I can, having some trouble with screen share. There we go, let's see. We'll go back. Can you all see that? Yep, okay. So I will be quick. This is a 12-slide deck, and full disclosure, this is a deck that I have used in providing an update to the Strategic Planning Advisory Committee. So a couple of the numbers are a little bit outdated because I gave the presentation just before the winter break, and I was unable to get updated numbers for this morning, but roughly you'll get a sense of where we are. So as you know, in the strategic plan, strategic initiative number 3 is to enable career development. That objective has 3 sub-objectives. One is really focused on students and alumni. Another is focused particularly on staff. And the third is focused on faculty. I intend to talk mostly about objective 3.2, which is providing staff with systemic professional development options and enabling them to grow their career opportunities. I will point out that Shana is one of the leads on this initiative, together with Mark Hoppola in the Office of Human Resources. I will also point out that as the strategic objective captain, I have been somewhat lax in convening my leads, particularly given that so much of the effort on this really has sort of stalled, for lack of a better term, under the pandemic. We have been really focused in trying to keep people fully employed, have all of their benefits, make sure they're in a good space mentally and physically, that really thinking about career development has, to some extent, becomes back burner. We are now refocusing and getting a little bit further ahead. All of that said, while we've not convened the group, we have been working behind the scenes on a much bigger project in terms of talent management. And that's what I'm going to spend my time talking about. So I've been on campus for just going on 6 years now. And really, since I arrived in the Office of Human Resources, we've been talking about the importance of putting together a learning management system, a single system where people could get all sorts of access to learning and career development tools, and then be able to track them. So every employee would have some sort of transcript outlining all of the classes or courses or opportunities they participated in. That conversation had been going on, and going back to our budget discussion, it was one of those things that came up every time, and then it was sort of, we get to 3/4 of the way through and then realize we didn't have the resources for it, or we'd get 3/4 of the way through and realize our technology wouldn't make it work. The system went forward with an RFP, however, in sort of in saying, like, we really need to have a broader learning management system tool that could also look at performance management, recruitment, and a handful of other things. Lucky for us, the RFP they put together actually identified Cornerstone as the company that they wanted to move forward with. And that was one of the companies we had been looking at previously. So we were able to get in on that contract together with the system. And I think in what is perhaps the largest miracle of state public higher education, we managed to get a contract signed on December 28th of 2019. And by July of 2020, we were able to put something in place. That is in large part because for the first time ever, finance, human resources, and IT really came together and put our heads together about how we could staff and finance such a program. And we were able to bring our costs down considerably, get a contract signed, and move it to implementation. There are a number of steps that happened in between. We came back from the winter break, did some kickoff events with sponsoring units, and then we solicited learning leads from across the campus. We knew that anything we put together, being driven out of HR in particular and together with IT, is just a platform, but it would require the units across campus to fill it with content that was useful. And we knew that we didn't have the expertise to do that. So we solicited learning leads from across the campus to help us inform the implementation process and then help us talk about what should be in the system. At the same time, we worked with a number of those learning leads and a number of other people to figure out what this should be branded as. We identified Carolina Talent. We went through a series of processes of putting some basic information into the system. We did some testing in June, and in July, the system went live. This, while terribly small and somewhat difficult to read, is a list of the learning leads. You'll note that almost all of these folks are staff. And we know that our staff are a key part of helping us know what tools and resources people need, either from a compliance, we need to have you trained in Connect Carolina usership in order to be able to do your job, or tools that can help you be better at your job, whether it's lynda.com services, Excel training, or unit-specific training about any number of topics. So we assembled this group. They have been meeting now, it's longer than 5 months, probably closer to 7 months, and they were the first group to actually test the system. We also have a subgroup of this group that's really creating the governance and content standards for what we put in the learning management system. We really made it a priority to put in our compliance functions first because we needed a more comprehensive structure to ensure that people get their adequate environmental health and safety training, their sexual assault and violence prevention training, their Connect Carolina training. So we're starting with compliance and then working to add additional pieces. You can see that we're working with several units. ITS and Clery training are really in that compliance space, but we're also working with Gillings and the registrar's office and some others to bring in some additional content. And then next up, we've got environmental health and safety, the School of Medicine, and the VC of Research. Ideally, the goal is to have every unit on campus provide learning opportunities in the system. And when we say we have this system, it's a system where you can log in and say, I'm Becky, and suddenly I can see I have all of these training opportunities. I can create a transcript. But where it really becomes functional is when we add the next module. And that is, we're going to add the performance module piece in. And so that when I go through my performance review, my supervisor can say, Becky, I'd really like you to take a course on engaging in difficult conversations. And I'd also like you to take Excel for beginners because you're miserable at that. And they could put that into my performance review, and then the program will trigger messages to me and ensure that I've taken the courses. And once I've completed them, it'll alert my supervisor. So it's intended to be a fully comprehensive system where I can both track my progress, my supervisor can assign and see things, and then I can also demonstrate that I've done these things and I'm eligible to advance in my career accordingly. And in some cases that will be, I'm eligible for a banding upgrade. In some cases that would be, I now have the skills to apply for another job elsewhere in the unit or elsewhere on campus. And in some cases that may be, I'm just better equipped to do something that I wasn't very equipped, and my rating might go up in my performance review moving forward. And then lastly, it may just be, this is something that's of interest to me, and I've now done every lynda.com session related to Excel or whatever it may be. I'm not going to read these comments, but when we went through the testing feedback, we had really good feedback from the various testers. They found that the system was pretty easy to use. It's simple for the end user, and it is not something that people will see as an administrative burden. So as of December, like I said, we launched it, and launch is probably an overstatement of what we did. We made it available. We sent a message out. We've not done a whole lot more because there's not as much in the system yet. Now there's more in it, but there hasn't been as much in the system to really have a grand rollout. But as of December, we had 3,300 users already using the system. They had, at that point in time, completed 4,350 learning objects. That is a weird term that the system uses, and 1,267 different full courses, and about 1,200 online sessions, including Zoom sessions in the system. I will say that the system is not without its challenges, and we are learning from feedback of the users along the way and from the learning leads as we put this together. The system is billed based on users. And so when we made our initial agreement, we thought most of our access would be required for permanent employees. What we have found is that a number of our compliance-based programs, our temporary employees are required to use as well. And there are a number of units who say, unless I can ensure that temporary employees and affiliates have access, I'm not going to put my content in the system. And that's a totally fair response. Unfortunately, we have to pay for every temporary user license, and we're just having to figure out the cost and how we manage that. Right now, we have a limited option for temporary employees. We can have them take 3 courses in the system, but not extend beyond that. We're trying to figure out, and we're working with the company to see if we can extend the options for temporary and affiliate employees more broadly. And that will be something that we and HR, as we consider our own budget cuts, how do we ensure that we provide more access and pay more for the process at a time when we have to manage our cuts? So we're navigating that, but it is something we're very aware of and know that we need to make available. It's also fair to say that this has been a difficult thing to roll out in the midst of the pandemic, in part because we haven't had as many courses roll into it in order to effectively roll it out, but we're making some more progress, particularly in the last couple of months. And as I mentioned, we are trying to connect this to performance management, and that implementation is underway right now, and I believe we're expected to see that completed by June. That's really the update on Carolina talent. Underneath the strategic opportunity 3.2, we also had strategic opportunities listed as recruiting and retaining top talent, developing digital lifelong learning programs and other professional development programs for staff, and then encouraging and promoting work-life balance. As I said at the beginning, we haven't focused as much on all of these non-cornerstone programs over the course of the last several months, but we haven't been ignoring them either. Many of you know we put in a much more comprehensive hiring playbook process, and we have reduced the time to hire to 45 days for both EHRA and SHRA employees. And that's a more than 100% decrease in time for EHRA employees and a pretty significant decrease in SHRA employees. We also have been able to survey and know that in 95.8% of those cases, hiring managers got their first choice. So it's not a question of are we seeing a decrease in quality by going faster? And we've also seen a more diverse set of pools through this process, in part because we've been able to keep pools whole. As candidates, we're not able to go look, or we're not going to look for other jobs while our process extended really long. So we're feeling optimistic about that, but continue to tweak that process moving forward. And then, as we mentioned before, we continue to work on efforts to support and retain our employees during COVID-19. I think it's fair to say the state and the system have been very generous with leave, and that we've not had to use lots of unpaid time, unpaid leave for employees. We've been able to support a fair amount of leave for employees, both managing care and illness. We've talked about some of that's coming to an end now, but we're now a year into working from home, and we've managed to do pretty well, all told, compared to many of our peers. We've also put in place a couple of other things. There's a brand new OHR podcast coming out that I think will be a fun listen should you get an opportunity to do so. We've got some LinkedIn learning programs. And then for the first time ever, one of the benefits of the pandemic, if you can call it a benefit. I'm not sure I'd ever, and maybe that's not the right word, but one of the opportunities has been, we've been able to do manager, supervisor, and department chair trainings out of OHR in a way that we've never done. We've had really large collections of these groups of people, and being able to distribute information about return to campus, about wellness opportunities. These are groups of people we've not convened in this fashion before. And I do think this is something that will continue post-pandemic. So it's something we're proud of, and another way that we can more broadly distribute information so that we see more equitable results moving forward. And then the last piece, well, we have just one person in OHR working on work-life wellness programming. For those of you who see the updates come out of both WorkWell and in the employee forum, you know that Jessica is creating and updating and providing more work-life wellness programming options. I mean, there are so many of them that our employees can take advantage of. And she's done an excellent job of collecting opportunities, some that are paid and some that are free. That we can work to ensure, beyond something as basic as the employee assistance program, that we are providing opportunities for our employees to seek physical and mental well-being opportunities beyond a more traditional EAP program. So I recognize that we're nearing the end of time, but that is sort of where we are. I should have included a link in here. I hope you all have the opportunity to log on to Carolina Talent. We welcome your feedback. And I know Shireen is working on getting our organizational leads together, so Shana can also bring feedback back to our strategic planning group on ways that we both might improve the Carolina Talent Program, but other initiatives you might want to see as part of building career development for employees, because that is on the docket for this semester. We do anticipate moving beyond Carolina Talent and putting some more things in play. And with that, I'm happy to take any questions.
Becky.
No, go ahead, Nicole. No, go ahead.
Becky, one of the questions that I get routinely about career and professional development, as I do climate assessments and I talk to other units, is that they don't feel like it's applied equitably. And so will there be some type of training or guidance for managers as we are rolling out these new initiatives to ensure that all employees have the same opportunities to take advantage of these new initiatives, particularly SHRA and EHRA employees tell me that they feel like the opportunity to take advantage of these aren't equitable. So I was just thinking that we might need to do something to make sure that managers are aware of how they're allowing employees to take advantage of these opportunities.
That's an excellent point. And it's true, there is disparity across campus about who has access, who's able to use their time. We anticipate being able to do a much broader rollout as we tie it to performance management, because we'd like to see employee or supervisors put in requests for training, but we'd also like employees to say, I would like to grow my career in this way. So as part of their own performance management, they're putting in requests for training, and then supervisors are also putting them in. And we're going to be able to see all of it on the back end so that we can see who's taking it, where we have gaps, where we have other spaces. So to answer your question, the hope is to do much broader training. The hope is to communicate broadly, both with supervisors and employees, about the ways that they can drive this career development. But then there's also the behind the scenes, where are we seeing gaps and how do we address them from the center to help those units do a better job.
And Becky, I will say I've been using Carolina Talent for months now. I kind of just ran across it when I was doing some stuff in Connect Carolina, and I started exploring it on my own. And there's 4 modules in there that kind of introduce you to Carolina Talent. And so I ended up going through it, and I did actually assign my whole staff training in there between LinkedIn Learning and some of the other training. And I did a demo in a staff meeting to show them what they could see versus what I could see, and that this was how I was going to be assigning some of their training going forward. So I do think if we're going to do a rollout, I mean, like I said, I just kind of ran across it, and I think it's excellent. And having been here about the same time as you, a little over 6 years, and having been at UNCW before that, I think it's only in the last 2 years that I've seen concerted effort to get staff trained. The Excel classes have been a huge help for staff that come in that do not get that skill. Many college kids do not get that skill, believe it or not, on how to use Excel. It's really surprising, actually. And so, having that skill set because that's like a daily part of our life here at UNC, having that skill set and being able to give that training to not only our staff, but our work study students and things like that is super helpful. And then the other training was, like the U-League class and some of the other like higher level management trainings and supervisor trainings, the best training, those things, I've taken all of them and I think they're very helpful. And I think what we need to do with the disparity, what Nicole was talking about, is to make sure that units are allowing for people to take those trainings and allowing for them to, because some of them are quite long. And so, when you're talking about a 3 or 4 or 5 hour training, you do need some time during the day maybe that you can carve out and really focus on that, because we can't all go home and continue working. So I do think it's I think it's important that we push that agenda. But I'm really loving Carolina Talent. I think it's a great program. It is fairly easy to use. There are some parts of it I think could be a little tweaked, but I think overall, once we get it up and running properly, it'll be a great tool for us as managers and leadership.
I promise, folks, I did not ask her to say that. But
no, she did not.
Thank you.
She did not.
But I'd love to certainly circle back with you, because one, if there are things that we can tweak, I'd love to do that. And two, if knowing how you've already used it, if we can sort of leverage your own experience in sort of thinking about how we roll this out, I think that would be great. So
absolutely.
I hope you don't mind if I follow up.
Becky,
great.
Can I?
Yeah.
Maybe not a question for right now, but like a follow-up at another meeting is, what I'm not seeing, and this might just be because I haven't really delved into this, is the connection between like learning new skills and collecting new skills and actual career advancement and professional advancement. So to me, it's one thing, either because my manager tells me to, or because I want to kind of advance Excel skills or what have you. But what does that mean for my professional advancement at Carolina? And, it's one thing if I look at a job posting at Duke and say, I need, XYZ Excel skills, I'm going to get them and then leave, versus I'm going to invest this time here, but what does it mean for my, professional development at UNC, and what doors does it open for me professionally in terms of salary advancement, what job type am I now eligible for? And then how do we move current employees up the ladder and through that? So that's the piece that I'm not seeing. And I'm wondering, again, sounds like a much bigger question than negative.
No, I think it's a totally fair question, and one that is part of the longer range planning. I think you have heard me say in employee forum, it's not something that I think it's not as easily solved as we might like, in part because we are bound by the rules of the state human resources system, which is not set as a career development ladder program, particularly for SHRA employees, but in part for EHRA employees. So it's not as simple as saying, if you take these next 4 courses, you're automatically set. And candidly, we've not done a remarkable job of succession planning at the institution, in part because our structures don't really allow for it. That said, there are some things we can put in place, and there is a whole lot of advocacy happening with our team and the system office to change even the way we do hiring and training and promotion, so that we are actually encouraging internal people to rise through the ranks, as opposed to go get that job at Duke and then come back, because our systems sometimes make that a better choice for you personally than they do trying to rise through the ranks here. So it's a both and it's not going to be as straightforward. And Cornerstone isn't going to solve it in and of itself, but being able to have an employee say, these are all the things I've done to demonstrate that I am equipped to go to the next round of banding, is one start. Because sometimes, to somebody's earlier point, supervisors don't always allow for some of these things. Well, if you're doing some of it on your own volition and you have this transcript, now I actually have a marker to show that I'm eligible for the next round, or whatever it may be. So it's one part of the puzzle, but there, to the point of the rest of the objectives underneath the strategic objectives, we'll have to get at what are we doing to build the succession plans, give people actually true career growth. I will tell you, though, even as we put together this strategic objective, the notion of career progression was one that we struggled with, because our systems don't really afford the true career growth as much as job growth. And that is like a little, we ended up going with career because we want to get there, even though we're not entirely structured to do it right now.
Thank you.
Yep.
Hi, Becky.
Hi there.
Hi, I'm on, well, within the employee forum, I'm on the Education and Career Development Committee. And so one thing, we're like starting new initiatives and wanting to do more. So I would invite you to join some of our meetings to try to help your initiative. So that's something I would like to get with you on.
Absolutely. We'd love that. And I want to be very clear, this progress, everything I've shown you, I have had about this much to do with. The credit goes to a whole bunch of other people, some of whom are on this screen, many of whom you work with that have really been part and parcel to making this happen. You've asked for a long time. We advocated to get the resources and the platform to make it happen. There are a handful of people in OHR who have made it work, but I can take very little credit for the work other than just announcing that we've made progress. There are way smarter people working on this than me. Yeah.
Hi, Becky. I'm wondering, you mentioned some of the incentives related to this program, especially with respect to performance review. And I'm wondering if there's any intent to do credentialing or micro-credentialing internally related to this program as well, like a certificate or something else that a person could mark on their CV after completing a certain number of courses.
I think that's absolutely the goal. I think the intent is to start by building the compliance piece in, get some larger learning opportunities in, and then talk about what credentials we can move forward and how we get to that place. That's absolutely where we're headed. We're trying to be realistic about doing so incrementally and getting some of the things in that we said we would get in first, but I do think that's where we're headed.
Okay, and one comment also about equity. It's sometimes said that email is not the best form of communication because many staff, depending on the role, may not have constant access or any access to a computer while they're working. That seems to be an even more critical issue with respect to a training that's primarily or exclusively online.
Mm-hmm. No, it's a totally fair point. And the platform will also track those who participate in in-person training. So while it is an online platform, it's intended also if you take an on-site program, when we get to that point again, say you go over to AOB and you take a day-long program on engaging in difficult conversations, that would ideally be tracked because the registration would have to happen through the center. We would put that in the system. It would show up on your transcript. That requires, however, to your point, that somebody knows that they need to go take that training or that they have a mechanism to get into the training on the front end. So your point is well taken, and one that I do know that our folks over in Oregon Professional Development are having more conversations about, both about targeting certain trainings to certain areas of the campus, but then also figuring out the best way to communicate them.
Thank you.
Yep.
So we're about 8 minutes over, and I want to be mindful of the time. And so let me remind you guys, I did set up an email that we can continue this conversation, and we can also meet as a group in between these meetings. So let's try to meet again before we meet with the Chancellor and Becky next time. So I'll be sending out a meeting or some options. And we also have the team site. Let me remind you to go to the team site, and I will set up another, there's currently an agenda spreadsheet, just add to that and we will get to them as we get to them. And are there any final?
If I could just quickly just again thank everyone, because already in this, I guess this is really our second meeting of the group, but the first one in which we took action on some things and had an opportunity to hear what's on your mind. And it's very helpful already. I've taken notes on a few of these areas just around categorizing some of the student services personnel that's on campus and making certain that we're categorizing them and prioritizing them along with some of our other essential frontline workers. I also think it's important that we hear from you, to Becky's follow-up from her presentation, that it pains me whenever I hear sometimes when it's too late that we're losing an incredible employee to another university or they're going off into industry to take a job because they didn't feel as if they had the upward mobility here that they thought they might. And so what we've just talked about for the last 30 minutes is incredibly important to moving us forward. And there may be other areas outside of what Becky's just presented that the Carolina Next